Hi, I'm Sally. We're here today to talk about the Intersect programme, which is an NHS leadership programme. I'd like to introduce you to Marina. Marina, could you tell us what your job role is?
Hi, I'm a Programme Director of Primary Care Transformation for South, Central and West CSU.
Great. Marina, it says on the advertising information about this course that it's about systems leadership. Could you explain that a bit?
Absolutely, yes. So previously to now, the health and care system in the main has operated in individual silos, which means that organisations have in the main looked after or operated within their own organisation. Evidence tells us after many years of working in this way that just isn't great for patients. It's not great for our workforce and staff who have to care for patients who operate outside of those organisations, and it really does mean that the system is a little bit disjointed and chaotic for our patients and service users.
So why do you think Intersect exists now in 2016?
So I've thought a lot about this, and the thing for me is that the challenges we face across public sector services at the moment are so great, and some of those challenges are around finance, the public purse, they're around workforce, and also one of the significant challenges for us is around an ageing population, which is absolutely great and determines the value of the services and the NHS on our population. But what this does mean is that the problems we face are so great they will not be solved in old ways of working and old thinking, which means that we as leaders within these systems need to think differently, and we also need to act in a very different way to be able to deliver answers to some of these very wicked issues. And so I think Intersect is very timely in turning our focus to thinking and acting as individuals and as systems very differently.
So how does Intersect work? What do you actually do on the course?
So Intersect works on a number of different levels. It's very experimental. Anybody who's thinking that they're going to be coming and somebody's going to be standing up taking them through a set of slides will be gravely disappointed. This is all very experimental, and it works on you in a number of different ways, both you as an individual, but also about the impact that you as an individual have on wider systems and wider individuals, and some of the feelings that your leadership brings out in others. Some of the bits that I've found to be most interesting are how we're configured. So there are 35 participants on the group, and we are broken into groups on many different levels. We have a praxis group, which includes 5 of us, that feels a bit like family. We're quite, trust and relationships built up very quickly. Then we have a small group that feels a bit more like a team, 10 of us in that, and then we have a big group, which is all 35 of us, which actually replicates for me on many different levels, wider systems and organisations as well. And this enables us to experimentally bring up concepts, test out some of the notions that are in the room, and also an opportunity to try out things as well.
Well, it all sounds very exciting, but I wonder, you often go on these courses and think, how is this actually going to change things? Do you think it's actually going to impact on service users?
Yeah, so for me and for many of the participants, it's really had a profound impact on us personally. And if something impacts on us personally, it will impact on the service users as well. And so there are numerous examples of that. One of my course participants was just telling me yesterday about the impact of the course on the hospice that she works in, and how that's enabled her to do some work with district nursing services on collaboration, how they join up care better for service users. And she said that some of what that has achieved in the space of months in comparison to years has been just phenomenal. And for me personally, it's enabled me to have a number of brave conversations with people within the system and with organisations about how we might tackle some of the more challenging agendas that exist within our communities that really do impact on the care that patients receive. And by that I mean, what do I need to know, or what do my teams need to know in order to care for you better? And let's not shy away from understanding more about what brings us all here. So our values, our behaviours, what we come to the table with in terms of bias and unconscious bias, being aware of all of these things that exist around both me as an individual and within my system, enables us all to work better and harder as one team.
Great, well thank you very much.
Thank you.